All right, good evening, everyone. My name is Megan Pfeiffer Davis. I am the manager of our Information and Justice Services Department here at St. Louis County Library. Thank you for joining us for this RECA information session. Before we begin, I have a few housekeeping rules that come to Zoom. So this presentation is being recorded and will be available on the library's YouTube page by the end of the week. Anyone that's registered and watching will receive the link once it is uploaded. Transcripts are enabled and can be turned on at any point in time if you would like. And because we're in webinar mode, your camera and microphone are disabled. We will have time for questions at the end. You can use the Q&A icon at the bottom of your screen to submit a question at any point, and I will ask them of the panelists at the end of this session. And if you're having audio issues, let us know in that Q&A as well, or you can try leaving and rejoining the session. We're so glad to host this session on the Radiation Exposure Compensation Act and to help provide information and resources to our community. This event is made possible through our partnership with St. Louis County government, Just Moms SDL, specifically with Dawn and Karen, Senator Josh Hawley's office, and then and we are joined tonight by the St. Louis County Health Department as well. So I'm pleased to introduce and pass it over to our St. Louis County Executive, Dr. Sam Page.
Hi, thank you, Megan. I'm Sam Page, your St. Louis County Executive, and I want to start this RECA session like we start all of our RECA sessions by thanking Just Moms STL for their leadership, many, many years of leadership, Karen and Dawn, in driving this opportunity through the legislative process. I want to thank Senator Hawley's office. I know Mandy's here with us tonight for getting this legislation enacted and making sure that the application process was able to continue even though we're in a tough time right now in our government. I want to recognize Danielle Spradley, who is very familiar with this issue. She is point on this for my office, is in the community, and doing everything she can to make sure St. Louis County government is there to provide the resources that we can that are necessary to complete these applications. And I want to thank the St. Louis County Library System for once again stepping up for something in our community that we need help with. We need the network and the staff and the sophistication of the library system. They're involved in a lot of things that aren't just books that make our community better. They're a great resource, and this is just another example of how they help us. And finally, I want to recognize that this issue, the RECA process, is just an example of what elected officials can do when they work together to make things better in St. Louis County, especially in North County. When elected officials work together on something they agree on, we can accomplish a lot, and RECA is just one example. And now I'd like to hand the program over to Dawn and Karen to tell us what's next.
Good evening, everybody. Thank you so much for attending tonight. Thank you, Dr. Page, for your leadership. Karen and I met you 13 years ago when you were Councilman Page then, and your district was over the Westlake landfill. And I remember talking about this issue with you and you being receptive. And I think it's just amazing that we're here tonight and that this has been accomplished. So thank you for standing with us this entire time and taking on this issue and helping us and guiding us. So RECA, the Radiation Exposure Compensation Act. There's a couple of really important points to bring up before you guys hear this presentation. First is that RECA has been around since the 1990s. It's almost 35 years old. And this program so far, without Missouri being included in it, has paid out over $2 billion. So the program works. It does compensate and it does pay out. It has for 35 years. It's a real program. And we're excited that as of July 4th, we were included in it, Missouri, for the first time. RECA covers Manhattan Project radioactive waste sites in St. Louis. It covers 21 zip codes that have been identified to be impacted, that the Department of Justice agrees has been impacted by radioactive waste and made people ill. What's important to know is it does not cover other toxic waste sites. We understand that within our region, there are many other toxic sites that impact our communities. And however, those illnesses that could have been caused by those are not part or covered under the Radiation Exposure Compensation Act. The second thing is that, or the third really, is the reality is we should have been one of the first communities added to this. Our uranium, for those of you who do not understand why we have radioactive waste in our community, the uranium from St. Louis was processed at downtown Malincrot and out at the Weldon Springs Uranium Processing plant directly next to Francis Howell. And once it was processed, it was then sent out west to other communities where the nuclear weapons were created and tested. So the reality is our community was one of the first communities in the nation that was contaminated. The documentation that we have sitting in front of you that you're looking at is from 1949. This is the earliest document that we have that shows that the federal government knew there was radioactive waste leaking into Coldwater Creek and that it was harmful. Since then, we have other documents that have helped make the case for RECA. And one of the reasons why Senator Hawley, once these documents were handed over to him, stepped forward and initiated and created the legislation to not only add us in, but to finish adding in the other communities across the nation that also were left out of RECA in the beginning and have always needed to be in it. You know, as Dr. Page mentioned, and as Karen's going to talk about in a second, we have spent a very long time advocating for RECA and have always needed inclusion in this program. And while we're excited that it is finally here, one thing that's important for those of you on this Zoom who currently are worried about what's in your backyards, especially if you live along North County and Coldwater Creek, we want you to know that we are going to fight. Everybody on this Zoom is a team, and we're all working together to make sure that we now turn and spend as much effort in getting this radioactive waste out of this community as we did to pass this legislation. Thank you.
So while Dawn just mentioned working together as a team, I think we need to step back a little bit and talk a little bit about why we are here, why these RECA compensation payments are being paid out. And that's because we were harmed by the federal government. And these payouts are an acknowledgement and an I'm sorry from the excuse me, from the federal government for this very reason. This is their acknowledgement of being harmed by radioactive waste. We here in St. Louis, however, have the most waste by volume and by acreage. There is no other place in this country that has what we have in our community. And it has affected many residential areas. While at one time, I think the idea was that it was pretty much contained in the industrial areas over by the airport. That was not the case. And they found out really by public pressure that it had gotten into our parks, in our schools, and into people's backyards. And so I want you guys to know that there has not been any cleanup in the creek since really the 2005 record of decision was made. Only the cleanup in the Jana Elementary, where the school was closed, has there been a cleanup. And really that again was because of the public pressure and the school closing. So like Dawn said, we are all in this together. And we need to come together and we need to find a way to get this cleanup expedited and to more protective levels. We believe that these two things can happen, but it's going to take all of you and all of us to push in the same direction. I'm going to turn it over, I think, maybe back to Megan.
Yes, so we'll hear from Dr. Cunningham next.
Perfect. Good afternoon. Well, good evening. I have a few slides here. I'll share my screen, but I will go off camera because my connection is unstable, but I did want to come on camera while I'm setting up so people can see who I am and I can introduce myself. But I am the St. Louis County Public Health Director. I appreciate being invited to speak to you all about the health impacts and a concern from the health department, but then also I want people to feel educated and to also become empowered, especially when it comes to discussing your health with your providers. I think a lot of information has focused on compensation, how to go about obtaining it, but I want to kind of pivot to really focus on the importance of the health risk that so many of us have faced. And I say us because I'm also from North County and from one of the RECA impacted zip codes. So let me share my screen. And I will cut my camera off. Okay. All right, can you all see the screen?
Yes, we can.
Okay, perfect. All right. So thank you so much. So your health matters. Just brief introduction. So of course, with RECA, the historical uranium deposits in North County place so many people at risk. We're talking about generations of individuals at risk, and even that risk still exists right now. The point of this presentation is to discuss the community impact, but more importantly, the public health impact. Understanding cancer risk, how to have this conversation with your doctors. What does it mean to get screened? And this is kind of unique. So it's unique in that it's an environmental exposure, and your typical insurance companies may not cover early screening. So we'll talk a little bit about that towards the end, and future direction of the health department to continue to support residents in St. Louis County, but then also our healthcare partners as well. Karen, we already discussed the Coldwater Creek. This is just a general overview about where the deposits were along Coldwater Creek. So definitely individuals who live closer to the creek are at a higher risk. But given the exposure throughout North County, that's one of the reasons why a majority of the North County zip codes were included in this, just given the length of the creek and the exposure to a lot of citizens in North County. So radiation exposure increases cancer risk, of course. There are other health-related risks, such as increased risk for developing cataracts, genetic mutations, of course, which could lead to the cancer, other risks like cardiovascular disease. But specifically for RECA, the cancer risk is what we're really concerned about. But I do want to bring attention to there's other risk factors or other risks that are also seen as well. So of course, living or working or going to school in any of the impacted area increase your cancer risk overall. One thing that we also saw with the data from the health department is that residents in RECA impacted zip codes are more likely to have multiple cancers. So breast cancer and lung cancer, or breast and colon cancer. So it is something that is unique to individuals from that zip code. Again, just to refresh everyone's memory with all the different cancers that are included in this, leukemia. I mean, a lot of these cancers don't have set standard guidelines for screening. So unfortunately, some of these are identified just from symptoms and presenting to your doctor, saying that you're difficulty with unexplained weight loss, or constant nausea and vomiting, and they can prompt an evaluation to rule out a cancer. So there are some standard screening cancer guidelines that exist, but for a lot of these, unfortunately, there are not any standard screening cancer guidelines. And so we'll get into a little bit with the symptoms, and I definitely can answer any questions during the Q&A session. So people living in RECA impacted zip codes were 18% more likely to be diagnosed with cancer compared to other areas in St. Louis County. If we look at the 5-year risk for individuals in RECA impacted zip codes, what we identified is that lung cancer was diagnosed 44% more frequently, followed by kidney cancer or renal cancer, and then colon cancer was 35% more frequently. Now, if we look at breast cancer by itself, breast cancer is the most commonly diagnosed, but if we look over the 5-year average, and if we compare non-RECA zip codes to RECA zip codes, that is where we're seeing that lung cancer is 44% more frequently diagnosed in those RECA impacted zip codes. And the same is for kidney or renal cancer, 40% more likely in a RECA zip code compared to a non-RECA zip code. And colon cancer is 35% more frequently. When we look at the RECA specific zip codes along and those cancers that are identified, breast cancer is the most commonly diagnosed in North County, followed by lung cancer. So we'll talk about that. And then prostate cancer, kidney and uterine cancer as well. The most common cancer deaths that we see in the county, lung cancer is the most common cancer death that we see, followed by breast, pancreas, colon, and then liver. I have a few slides just to really talk about breast cancer. So what's really interesting with breast cancer, when we look at all of the data in St. Louis County, we actually see similar rates of breast cancer incidence, meaning new cases of breast cancer, similar among Black women and white women. But when we look specifically at RECA impacted zip codes, we actually see that Black women are actually diagnosed at a higher rate, but also dying at a higher rate in North County. So again, I want to make that clear that when we look at all of North County and all of St. Louis County, we see similar rates of new diagnoses, but specifically when we look at North County, we're seeing a higher mortality rates or higher death rate among our Black women, and we're seeing more Black women being diagnosed. So breast cancer, of course, very serious. Other things that we have a report that we can, I'll be happy to share with this group, but also with breast cancer, we see that later stages of diagnoses, we'll talk about the importance of screening, but for breast cancer, we have way more advanced treatment options and screening options for breast cancer. And we're still seeing a significant impact in North County, but also is true for all of St. Louis County as well. So why does screening matters? Early detection saves lives. I think some people, there are some myths surrounding screening that, oh, if I go in and get screened, they're going to find cancer. Well, if you want to continue with that same type of thinking, you actually want to identify early signs of cancer versus, presenting to your doctor's office or to the emergency department when you're in stage 4 or a more severe disease. So early detection saves lives. I always encourage talking to your provider to understand what are the screening recommendations for your age. Now, what's unique with this is that screening recommendations come out, national guidelines that we have. What's unique for us in North County is that we have a unique environmental exposure, so radiation exposure, which we know increase the risk of cancer. So one concern is that we know this exists in North County. How can we get our insurance payers, how can we get our hospital systems and healthcare systems on board with offering early screening options for some of these cancers that have known screening tests? So for example, with breast cancer. Right now, the recommendation is we recommend for breast cancer to start screening to start at age 40. For individuals in a RECA impacted zip code, we may need to lower the age to 35 for screening, given that we know that breast cancer is more commonly diagnosed and there's a higher incidence of individuals dying for breast cancer. And this same type of thinking is the same for colon cancer and some of your other standard screenings that we have for cancers. I listed here a few locations that people can go to discuss cancer screenings. Now, all of these locations, they will ask you to establish care. If you do have, a doctor's office at SSM, Mercy, or BJC, you can also discuss screening options with those providers as well. So what can residents do? Of course, talk to your healthcare provider, share your radiation history. A lot of times as a physician, we'll ask about family history, but we don't always tend to ask about environmental history. And so one thing this would be important as you're seeing your provider or your next appointment, let them know that this radiation exposure, this history exists in North County. You can also direct them to the health department site as well, to where providers can learn a little bit about this. I did send out information to a lot of our healthcare partners so that physicians are aware that this risk exists, but I want people to feel empowered and encouraged to speak up and bring up this radiation exposure history, because we don't routinely ask about this in our normal day-to-day seeing patients at a primary care level. Ask about screening tests that are available. Again, there are standard screenings for breast cancer, colon cancer, but we don't have standard screenings for leukemia or for some of your other cancers like brain cancer. That unfortunately is determined by signs and symptoms. But talk to your doctor about that. What does brain cancer look like for individuals? What are the symptoms of leukemia? That way you can also feel encouraged. If you start to feel like you're developing those symptoms, you won't wait until the last minute to go and be seen. And other things, of course, lifestyle factors, reducing or completely stopping tobacco use. We do know that tobacco is linked to a significant number of head and throat cancers, lung cancers as well. Alcohol use is definitely linked to liver cancer, maintaining a healthy diet and activity, and reduce other environmental exposures whenever possible. So earlier when we were discussing that environmental exposure still exists, is even more important now for us to prioritize St. Louis at being at the top of the list for cleanup efforts, because that exposure, that risk still exists to this day. So once you see your provider, what kind of questions should you ask? What cancer screening tests do you recommend for someone my age? It can vary if you're 65 compared to someone who could be 30. How often should I get screened? That can also vary based off of family history, and now a known environmental history as well. Where can I go to get screened? Again, a lot of your hospital systems are your healthcare centers. Of course, the health department as well. We do provide direct clinical services, and where we're able to make referrals and also engage individuals in this conversation. Do I need to do anything to prepare? Sometimes for a colonoscopy, you would need a designated driver to drive you back home. Going for a mammogram, you may not need that type of assistance. Are there any risks to getting screened? A lot of people think that sometimes the imaging that is used, there may be a risk to that. Right now, there's not an increased risk for the current imaging modalities that we use. How long will it take to get test results? How would you tell me about the test results? Do I need to come in for another appointment? Would this be all communicated through the EMR? And then what does it mean if my test results are normal? Should I get screened again next year, 2 years, 5 years? Or what does it mean if my results are abnormal? What does that mean? What would be the next steps then? So your voice, your health. So know your history. Again, I am encouraging everyone to bring this up to their provider. If your provider don't bring it up, I want you to bring it up. You have great resources on St. Louis County's website, as well as the Department of Public Health website. You can refer your provider to those websites, or even refer to the health alert the department had issued 3 weeks ago. Schedule an appointment. Engage your provider in this discussion, because some of these cancers can be diagnosed later in life. So have this discussion, identify your environmental risk, your family risk, and what does that mean for you as an individual, as well as for your families. Ask questions. Write your questions down. Sometimes when you're in a room, you can forget about the question when you're engaging in a conversation, but come with your list of questions. Therefore, you won't forget, and you will feel comfortable and confident knowing that your provider answered all of your questions at that visit. Take notes as well. A lot of times we can't retain all the information. Signs and symptoms vary based off of different cancers. There's different screening guidelines for each of the different cancers. So definitely take notes. Ask all your questions that you can. And then bring support. If you are concerned that there may be early stage of cancer, bring a trusted friend or family member to that appointment as well. Everyone needs support, and bring somebody to that appointment with you. So key takeaways: residents with a history of living, working, or attending school in RECA impacted zip codes are more likely to develop cancers from the radioactive waste, and that risk still exists today. Cancers associated with radiation exposure are diagnosed more often in RECA impacted zip codes. Again, sometimes we may see multiple cancers within an individual. Community members affected by radiation exposure to take steps to understand your cancer risk. The health department will continue to put out information with this. I think this is something that is critical. It will be ever evolving. I think right now what we're trying to do is to modify the current standard screening guidelines. So either healthcare insurance will cover this, or either we can get some of our hospital partners on board to assist with the need. Get screened and detect cancer early. Again, getting screened does not mean they're going to find cancer. Getting screened means that if I do have cancer, it will be caught early enough, meaning that my chances of survival, of coming through this, is actually greater than identifying a cancer diagnosis stage 4. And again, developing new screening guidelines that are specific for individuals with RECA impacted zip codes. So the health department is deeply involved in this, and we will continue to publish and issue information as we continue to work with our community partners in St. Louis County. So your health, your power, and I will recommend and encourage everyone to get screened. And if at minimal, have the conversation with your provider. And Megan, that is it for me. I don't know who is the next person, but I will stop sharing my screen right now.
Yes, thank you so much, Dr. Cunningham. Amanda, she's been answering away a lot of the questions in the Q&A. So if you have questions, go ahead and check that Q&A and see if it's already been answered. But we're going to pass it over to Amanda.
Thank you so much, Megan, and just my gratitude on behalf of Senator Hawley to Dawn and Karen, Just Moms STL, to St. Louis County, to the St. Louis County Library. Dr. Cunningham, thank you so much for that presentation. RECA has been Senator Hawley's priority for the past 2 years as an act of legislation. But even though we have succeeded in getting RECA expanded to include Missouri, that does not mean that Senator Hawley is not concerned about this issue anymore. He actually talks about it daily to all of his staff. It is still his top priority, and he is absolutely committed to making sure that every eligible Missourian receives information about this program and receives assistance to apply. And we're also concerned about the ongoing health of the residents in the St. Louis area, whether they're currently living here or they've since moved away. And so we will be keeping an eye on all that's involved in that. But we are here to serve.
All right, thank you, Amanda. And Danielle, over to you.
All right, thank you so much. I'm going to go ahead and share our presentation, so I'll go ahead and turn my video off. All right, so as you've heard from everyone that spoke before us, obviously the Radiation Exposure Compensation Act has been amended to include Missouri and North County as well. RECA has been a program since 1994 in other states, but we are so thankful for the work that Senator Hawley did to get this across the finish line and include Missouri. So what does this mean for St. Louis County? It means that thousands of current and former St. Louis County residents and those who either also worked or went to school in these impacted zip codes for 2 or more years after January 1st, 1949 and contracted certain cancers will be eligible to receive compensation as either reimbursement for their documented out-of-pocket medical expenses occurred as a result of the cancer or a one-time tax-free payment of $50,000. And I want to stress it is a tax-free payment of $50,000. The expansion of RECA also includes survivor benefits for the surviving spouse or surviving children of a deceased individual who qualified for RECA. And those survivor benefits will be a one-time tax-free payment of $25,000. So, as you can see, these are the impacted zip codes in North County. As you've heard, there are St. Louis City zip codes and St. Charles County zip codes included, but these are the North County zip codes or St. Louis County zip codes that are included. You see that 63136 and 63137 are not. There is still work to be done on that. And this is a list of all of the included zip codes that include St. Louis City and St. Charles County. So Dr. Cunningham already went over what the eligible cancers are, but RECA compensates individuals with certain cancers. The onset of the cancer must occur at least 2 years after the initial exposure to the impacted zip code. So what that means is someone has to have spent at least 2 years either living, working, or going to school in an impacted zip code before their cancer was diagnosed. So if your cancer was diagnosed before you lived in North County or in one of the impacted zip codes, that would not make you eligible. But if you were in that zip code for at least 2 years, and then however long afterwards you were diagnosed, so say you were in the impacted zip code in 1952 and 1956, but you weren't diagnosed till 1980 or 2000, you are eligible for those RECA benefits if you have one of the eligible cancers. So the qualifying cancers are any leukemia, provided that the first radiation exposure occurred at or after age 20. Lymphoma, except Hodgkin's disease. So non-Hodgkin's disease is eligible. Hodgkin's disease is not. And we can see that Any of the following primary cancers, provided the onset was again at least 2 years after living, working, or going to school in the impacted zip code. We have multiple myeloma, lymphoma other than Hodgkin's disease, thyroids, male and female breast cancer. Men do get breast cancer, so please know that that is a possibility. Esophageal, stomach, pharynx, small intestine, pancreas, bile ducts, gallbladder, salivary gland, urinary bladder, brain, colon, ovary, bone, renal, aka kidney, lung, and liver, except if cirrhosis or hepatitis B is indicated. So how do impacted individuals apply? So right now you have to apply via the mail with a paper application. And to apply for this compensation under RECA, you'll need to file a claim with the Department of Justice and provide supporting document that demonstrates your RECA eligibility based on your cancer diagnosis and exposure history. At this moment, the forms must be physically printed out and mailed in. You can download the form from the Department of Justice RECA website, Senator Hawley's RECA webpage, St. Louis County's RECA page, or RECA-Missouri-Resources.org, which is just Mom STL's RECA webpage that has a host of information on there. You can also pick up an application at any St. Louis County library location. They will have printed out applications. If you're downloading from the DOJ website, I want to make sure that you download the Manhattan Project Waste Claim Form. As mentioned earlier, RECA has been a program since 1994, and the Missouri program has its own claim form. It's called the Manhattan Project Waste Claim Form, and on that application, it will say Manhattan Project Waste Claim Form. So, one of the biggest parts of the application is proving either that you either lived, worked, or went to school in the area, or the deceased lived, worked, or went to school in the impacted zip codes. And there are many ways to figure out or get different ways of getting documentation. And some of the documents that you're going to need is marriage records, divorce records, death records. You can use personal letters or envelopes. Remember, if you have an envelope with an address on it that's stamped, that's a federal document because it was stamped by the U.S. Postal Service, which is a federal agency. That's why if you mess with someone's mail, that's considered a federal felony, a federal offense. Church and religious records. One thing we know is the Archdiocese keeps amazing records and has a RECA form that you can fill out with the Archdiocese. Voting records, your school records are going to be really important for people that grew up in North County. We have a lot of folks that grew up in North County, went to school, and are no longer living in the area. Their best way to prove their residency is by going through their school transcripts or school yearbooks. Government records. So when you're talking about tax records, when you're talking about deeds, and even HR records. If you lived, again, if you worked in the area, you are eligible. Utility bills, you can send in your original utility bills, and that's going to be a proof of residency, right? That shows that you were living there paying a utility bill. And then, of course, obtaining your medical records and birth records. So the documents necessary will differ depending on whether you're self-filing or filing as a beneficiary. One thing you will most likely need is birth certificates for sure. Marriage certificates are going to be necessary if you're filing as a surviving spouse, but also if you have name changes. So if you changed your name during a marriage, you're going to need that marriage certificate to prove that name change. And marriage certificates, if you are married in St. Louis County, and your birth certificates, you can get that through St. Louis County. So one important thing is for a lot of this, if you're not sending in an original document, you need to have your document certified. So certified photocopies are often stamped with the seal of an issuing institution. Typically, these seals are either raised, colored, or signed in ink. So if you have a document that has been stamped, the DOJ says to send them that document. So one thing that the library and a lot of our institutions are doing is they are attaching a cover letter that is signed with wet ink stating that this is a true and real document that is in the the issuing institution's records, and that can be used as a certified record. With St. Louis County, on a lot of the tax record, we are using a wet stamp with a wet signature that's dated to certify our documents. So, for information on how to obtain county documents, you can visit St. Louis County RECA's webpage. You can access this by visiting the St. Louis County homepage and clicking this icon, or just go to stlouiscountymo.gov/RECA, and there's a whole host of information and resources on that webpage. This is another look at the webpage and where you can obtain different documents from St. Louis County. It goes into different documents you may need and other information, as well as having these webinars. If you want to watch this again, we'll have this back up on the page and other information and resources to help you. So once you have gathered all your documents, your RECA documents for your application, you're going to have to send that in via mail to this address. This address is on the application. So this won't be the only time you see this address. Again, this address is on the application. We do recommend that you send in your application certified mail. That's going to help your anxiety. That's going to let you know, hey, it's arrived, it hasn't arrived. You want to send that certified so you know it gets there, you know when it arrived, and you can have a tracking number on that package. So for assisting acquiring documents that you may need, the St. Louis County Department of Revenue, the Department of Public Health, the Assessor's Office, and our Human Resources Department can help you with a host of different documents, whether that's getting deeds, tax records, HR records, birth certificates, marriage certificates. We can get you short form death certificates, but one thing with RECA I do want to recommend, especially if you are filing as a beneficiary, is getting the long form death certificate from the state. We know a lot of folks are having a hard time getting hospital records because through federal and state law, they only need to keep records for about 7 years and then 10 years for some diagnoses after the person's death. So they may not have those hospital records, but one way is looking at trying to get a copy of the long form death certificate from the state that quite often, even if the person did not die from said cancer, their diagnosis will very often be on that long form death certificate. Voting records, and I know that I'm going to let Brent go into it further, but voting records are another great way of showing residency. Your federal and state offices, they can help you find military records, IRS records. The state can get you your long form death certificate, as well as we have a lot of federal employees and a lot of state employees in the area. And those HR records can also show, okay, you lived in the area. And I'm not going to go into too much detail about what the amazing St. Louis County Library can do because we're here for them to present what they can do for you, but they are an amazing resource. Other ways of assistance acquiring documents is your municipalities, especially for renters. A lot of times they may still have occupancy permits that can show you lived in the area if you didn't have property tax records, if you're a renter, so you don't have any deeds, you don't have real estate records, there is a possibility of that. Your educational institutions and school districts, as I was saying earlier, your yearbooks are going to help if you were a child growing up or in this area. Your enrollment records, and again, HR records. And for example, if I went to I did go to Florissant Valley for 2 years. If I was diagnosed with one of the eligible cancers, I could reach out to Florissant Valley Community College, get my school records, and that's a way of proving that I went to school in the impacted zip codes. Your medical institutions and providers, many of the medical, I would say almost all of the medical providers in the area are now well aware of RECA and are working to get records as quickly as they can to you. And your employers and labor unions. So a lot of employers are going to have some health records and employment records that can help you either prove that you were in the area or have your health records. And our faith-based institutions, depending on which faith-based institution, some have records of baptismal records or different religious records that could possibly show that you were living in the area and that you were in the area for over 2 years. If you are needing assistance filling out your application, so you think, okay, I've gotten all of my records, I want to have somebody check over my application and look at this application for me and make sure it's ready to go, you can reach out to the Pink Angels Resource Hub at 620 North Lafayette, or email the Pink Angels Foundation at gmail.com. They are going over your applications, but they will also help you in assisting finding documents. If you're having an issue with getting on your computer, or you just want that extra help and care, the Pink Angels Foundation is a great resource, and reaching out and making an appointment with them to help you with your applications is a good option. One thing I do want to make everyone aware of, and I know I've seen it on my social media a lot, especially when RECA was first passed, is fraud. We have a lot of law firms in the that are trying to take advantage of this situation. And we know that they've been putting out Facebook ads asking for people to sign up for lawsuits, telling them they will help them file their claims. It is illegal for any attorney or law firm to charge you more than 2% to help with filling out your applications. But one concern we have is in the law, if you're first trying filling out the application does not go well, they can then charge you 10% for your second try, because to apply for RECA, you have 3 times to try out for RECA or to apply for RECA. So we have all worked very hard to make sure that there are enough resources that you are not going to need to have an attorney help you fill out this application. If you are getting calls from the DOJ, one thing we've heard of is people that get phone calls saying that they are from the Department of Justice and they're trying to get sensitive information from you. The Department of Justice is not calling you unless they're trying to serve you a subpoena. So one thing is, the Department of Justice is not going to get a hold of you unless, one, you've already sent in your RECA application, right? And they're going to get a hold of you through the mail. They're going to send you your claim number in your mail, and then you will have a caseworker that you can talk to. So if you're getting phone calls and you have not turned in your application saying it's the Department of Justice, we please want you to report that to the Missouri Attorney General's office, as well as Senator Hawley's RECA hotline or the Department of Justice, to let them know, because they will prosecute these people that are trying to charge exorbitant fees and take advantage of folks that are trying to apply for RECA compensation. If you have questions regarding RECA, we have a whole host of resources here for folks that you can call. As you saw, Dr. Amanda earlier from Senator Hawley's office, they have a RECA hotline, as well as Just Moms STL. And regarding county documents, we have a RECA support at stlouiscountymo.gov email. That is me. I'll try to get to it as quickly as I can to help you, as well as the application assistance with the pinkangelsfoundation.com. One thing I do want to say, and this is when we're also talking about getting your documents, we want to kind of show everyone some grace. Right now, there are thousands of people trying to get documents and get questions answered at the same time. So that's really putting stress on our school districts and our institutions. So just give them some grace. They're going to try to get to you. They are getting to you. It may take a little bit, but everybody's here working together to make sure you can get the things you need. So some commonly asked questions: if I'm suffering from more than one type of cancer, do I receive $50,000 for each illness? No. So I'm going to use my sister as an example. She has 3 primary cancers. She grew up along the creek and has lived in the impacted zip codes for already over 50 years. She can only receive one payment of $50,000 or reimbursement for her documented out-of-pocket medical expenses. And that's not both. It's $50,000 or reimbursement for documented out-of-pocket medical expenses, but only one time. Even though she has 3 primary cancers, she only gets one payment of $50,000. Why is my illness not included? As Dr. Cunningham mentioned earlier, we see other diseases that pop up in North County due to radiation exposure. But with RECA, the RECA expansion covers certain specified cancers that have a well-established link to radiation exposure based on scientific evidence and statistical associations. Unfortunately, there is more work to be done to get other cancers on autoimmune disorders included in RECA. We know Just Moms knows, like their diseases in their family are not covered. They fought, and the original language had other diseases in it, but the DOJ would only allow the diseases that are currently in RECA to be used in this program. There's still more work to be done. We know Senator Hawley's office, if you do have other cancers, we see a lot of prostate cancer and other cancers in North County. We see a lot of autoimmune disorders. Please, if you have those, call Senator Hawley's RECA hotline and let his office know that you have these other cancers or other diseases. They're collecting that information so that we can continue to do the work to try to add these other cancers and other zip codes. So when is your application due? The application window will close on December 31st, 2027. That means you need to get your application in by December 31st, 2027. We know applications are being processed on a rolling basis. So right now, if you get your applications in now, you're going to be getting your application processed sooner. But they will pay out after December 31st. If you get your application in on December 30th, they have up to a year to pay you out on those applications or process those applications. So again, there's trusted resource websites here with Senator Hawley's office, Just Moms, STL, the DOJ, and St. Louis County, as well as I'll let the St. Louis Library share their information. And that's it from me.
Thank you, Danielle. Brent, over to you.
All right. Let's see here. Hello, I'm Brent Shroud, and I'm with the St. Louis County Library History and Genealogy Department, and I'm going to go through how St. Louis County Library can help you with your RECA claim. So we've been helping people ever since the application went live. We've changed some things around. We found more sources, so we're always continuing to find efforts to be able to assist you. So one thing I want to say is that we cannot fill out the form for you. We just aren't at that capacity to be able to complete the form for you. So you can get a form from us. We can provide you residency documentation, but we cannot fill out the form or help you fill out the form. And we cannot assist with medical documentation. We can help you find books about medical things, but we can definitely not assist you with medical documentation. We are librarians. So, and the stuff that we are providing you is based upon the information that we've been provided. So we're working off the knowledge that we have. So please just give us a little grace on that. And you are able to get a free copy of the application from our branches, any branch in our system. So we have quite a few, and I'll show a map of that later. But you can get one free form. We also will certify documentation provided that we can access it. And I'll talk more about that in a little bit. So let's go forth. So here is a RECA portal, just like everybody else that we established when this first went live. And it has helpful links, it has guides, it has resources where you can find that residency documentation. So the St. Louis County Library is really focusing on the residency documentation because that's where we're really equipped to help you with. But it also has links to our partners in St. Louis County and the form itself. So I've been helping people for a long time with this now, and I want you to know that it's going to be okay. We're going to get there. So before you do anything, before you start filing, before you start running around grabbing all the documents and calling your friends, do me a favor and just get a form. Get one of the forms and read it 3 times. Go through the Manhattan Project Waste Claims section. No other section will apply to you in this case, but read it 3 times. And I mean, read it slowly, just digest it. See what it's asking you to do, because this is huge, because if you rush through it, you're going to have questions that are plainly spelled out there. So, and as I mentioned before, forms are available at any SLCL branch, and they can be printed from several sources. Also, reminder, if you have a library card with us, which if you don't, come get one. We're here. You get $5 print credit every month. So just walking through a little bit of the form, because I think this is important. The main thing, when you open up this form, there will be a part 1, which is just basically you identifying yourself. The part 2 is you identifying the claimant. And we run into this problem a lot. I want you to remember, the claimant is the person who was ill. So you may be self-filing. If you're self-filing and you had a cancer that's eligible, you are the claimant. If you are filing for your spouse who passed away, they are the claimant. If you're filing for your mother and she passed away and you are a daughter, son, your mother is the claimant. So that is a huge thing. And when you see documentation come from us, the claimant will always list the person who is sick. So you will go through the next part. You will identify your relationship to the person who was ill. So is it yourself? Is it your spouse? Are you the child of the person? Are you the spouse of the person I meant to say? So if you're a self-filer, this will be an easier path than if you're filing for a parent. So you got to have, and there's phases of this. You have to get your government documentation. So these are going to be your vital records. So birth certificates, marriage certificates. Everybody's going to have to find a birth certificate. Trust me on this. And we'll talk about how to get that. And we can always help you at the St. Louis County Library with resources to get those. We cannot get them for you. And if you just follow these steps, it'll tell you after you fill this, go on to part 8 or part 6, whatever it says. Just follow the instructions, go slow. There's no race here. You have until December 31st of 2027. So surviving spouse, it asks you a series of questions to determine if you're eligible or not. And then it will supply you. And you can see the documents that are needed are increasing at this point. And one thing to point, they have to be original or certified. And we've talked about how you can get them certified. I'll talk again about that. But yes, in cases, if your surviving spouse was married before you, you will have to document the divorce or the death of the other spouse. So it's basically the Department of Justice wants to establish a chain of who's going to get this funding. So you may ask yourself, I have a lot of patrons that are like, why on earth would they need that? He was married 55 years ago. This is what they're asking for. These things are not impossible to get, by the way. You can get help getting this. If you're a surviving child, it asks you how to determine that. And then you can see the requirements are even more. And all of your siblings, you will have to submit a birth certificate, a marriage certificate, if there was a name change for your siblings. And then actually the siblings are encouraged to sign the form in a section. And I want to put this out there. If they're not able to sign said form, you can still proceed. The Department of Justice will just have to do the work for you. So just remember, take it slow, read all the requirements. It's not too much to get. You can get this. So remember, if the box is there, it is required. The only time it's not required is if it says marriage certificate documenting all of your name changes. If you've never changed your name, you don't need that. So exposure, you will check the zip codes where you live, work, or went to school. Remember, it does not have to be, I have some patrons that are, did I have to live and go to school and work all 3? No, just one. And you need to document 24 months total, not consecutive, just total. So it could have been a year here, a year later. And just remember, you have to have been in the area 2 years before the onset of cancer. So you list that, you check the boxes, provide the towns, the dates, and then we're going to work on providing our residency documentation. And that's where we get to here. So, and I used to be a former teacher, so I like to repeat myself. Remember, live, work, or go to school. And these are from the application, but remember, you can use so many more documents. You're not just confined to these documents. Tax records, school records, employment records, birth and marriage records, personal letters. We use directories a lot. We use yearbooks a lot. You have to be creative sometimes because sometimes you're just not documented. So one thing I really want to focus on here, some folks were children where they lived in these zip codes and they moved away when they were older. It's almost impossible to document a child before school age living in one of these zip codes. So we have to document your parents living there. The Department of Justice works under the assumption that a child, a minor, lives with their parents. Likewise, a spouse will live with their spouse. So when we're looking at some resources that sometimes spouses aren't listed, but the husband, the head of house will be listed. Well, there is an implication, there's an assumption that a spouse lives together, a child lives together. So you'll notice right here, a member of his or her immediate family residing in the same household. So in some cases, we get people like, I live with my grandparents. Yes, you can use that in that case, but you're going to have to provide the proof. You're going to have to, that's another chain of there. So one thing we haven't really talked about that I think is very important, a lot of people, as mentioned earlier, it is sometimes hard to get your medical documentation or to get documentation for folks that have been through this. The Cancer Registry for Missouri, this is an option in the form, page 10 and 14. So page 10, you'll check a box, page 14, you'll sign and release. You need to fill this out. I encourage everyone to fill it out regardless. Just the Department of Justice will contact the Missouri Cancer Registry and pull any documentation. And one thing I like to mention here is that the Cancer Registry can pretty much any cancer diagnosed in Missouri from 84 onward will be in the Cancer Registry. So in many cases, this is the only medical documentation because there's just, I think we have this assumption that everyone keeps records for indefinitely. We don't, not everybody does. So 1984 and onward, pretty good chance. There are some cases beforehand because it was voluntary reporting. So utilize that source. And as mentioned earlier, long form death certificates, if that states the cancer on there, a qualifying cancer, that is proof enough right there. So you don't even have to look for these medical records. So going back to our RECA portal, here are some of the documentation resources that we provide information on how to access. So St. Louis County Library has lots of databases. We have lots of different things that we can utilize so that you can utilize at home. And I'll go through those processes of how to get help in person, how to get help at home or at a branch. So one thing that we're offering in the History and Genealogy Department is a residency documentation lookup request. So you can submit this form here on the RECA portal, and we will actually do the looking for you. We'll find the documentation and we will email it to you. And so right now there's a 2 to 4 week turnaround. We fulfill it in the form of an email with attachments and certification. So we have worked it out with the Department of Justice that, and this, you'll see this on the form, it has to be signed in ink. We have worked it out with the Department of Justice that we can send you our scanned copy of our certification form signed by us. It's just a necessity to fill all these requests. So we will attempt to locate the information for you. I'm going to give you some tips on how to fill that out because the easier you make it for us, the easier we'll get it for you. So you can take a look at the form here. Very simple stuff. What is your name? The person requesting it. What is your name? What is your phone number, your email address? We might call you. We might have to call you and say, hey, we found this, but we didn't find this. Can you help us out? The full legal name of the person. So if you're doing it for yourself, you can just say myself, click, check the box. Another person, check that, list the name there. List all the name changes and when they might have been used. You know, if they were married 3 or 4 times, list all of those changes with the kind or the period of time that the best you can recall. List the full legal name of any spouse. When we get down to the list of other people in the household that might help with documentation, those will be your parents. If you lived in one of the impacted zip codes as a child, please list your parents in the household there. That will help us because, like, once again, the Department of Justice has an assumption that a minor lives with their parents. So, tips for submitting your request. Provide as much information as possible. You don't have to write a life story, but think of all the zip codes that you lived in, and please do not supply us any information after you were diagnosed. So if you were diagnosed in 2022, provide us from your birth until 2021. We're happy right there to help you with that. And it will minimize the back and forth that we have to go. And I want to remind you that RECA is looking for 24 months of residency. It's not a homework assignment. It's not a paper for school. Submitting 50 years does not get you an A+. You just need to submit 24 months. So in some cases, we'll find a gap where we can give you 36 months, but 24 months is really all you need. Submitting any more just takes more time for the processor to go through it. So another thing, so 2 to 4 weeks, and you'll see that everybody who's taking in documentations, like the Board of Elections and all those folks, they have a huge turnaround. It's because we have so many, because there are so many people that need help, and we're here to help you. So please don't call us a week later and say, where's my request at? Where's my request at? Now, if you don't see something 2 months later, and I know that sounds crazy, 8 weeks, you can definitely, say, hey, I submitted this 8 weeks ago. I'm just checking if everything's okay. Sometimes things fall through the cracks or, technology. But one thing I do want to ask you, and a lot of people have email addresses that are filtering the St. Louis County Library. So we email people all the time who then contact us and they'll say, I never got this. Your spam got it. So please check your spam. So it will come from an slcl.org email address. So if you search that in your inbox, you can always check to see if we've emailed you. So this is just another case of a reminder of the zip codes. So these are the zip codes that are impacted. As mentioned earlier, more zip codes need to be added, and I hope one day that happens. In the meantime, until that happens, feel free to gather the documentation, but please don't apply unless you are eligible. Please don't apply unless one of these zip codes with your residency. And please don't guess. I mean, try to know, like, I actually did live in North County, or, don't just shoot the moon. But 24 total months, it does not have to be consecutive. You know what, you could have lived 2 months every year for 12 years, and then bam, that's 24 months. So speaking of the St. Louis County Library and how you can access sources and how you can do your own research, and remember, if you do the research and find the items, you bring them into any branch, we can certify it for you, assuming that we have access to the item. So there's in-branch access at any St. Louis County Library. You can see a map. We are all over the place. We're here to help you everywhere in St. Louis County. I'm over at the Emerson History and Genealogy Center. That is at the Clark family branch. That is the one over across from Plaza Frontenac on Lindbergh. So we have even greater resources than the branches. So we have directory documentations, we have yearbooks, we have all sorts of things. So you can try your local branch, and if you can't find the source there, you can come visit us. You can also do some of this at home, and I'll show you how. So every branch has access to Ancestry. So you can go in there, it's on the A to Z resource list. You can find census records. So keep in mind, 1950 census is public. So that's after 1949. So if you are on the 1950 census in one of the areas, it will list the area, the house, and the street address. That is 1 year right there. But you can also find death records on there. You can find public record databases. These are records that will help you pinpoint what you're looking for as far as the address and the year. There's also a family search system that we have access to as an affiliate. It has more directories on it. It has newspapers, it has Social Security Death Index, and you can use that here. You can also use parts of that at home. And we have access to the Digital St. Louis Post Dispatch, the archive. So remember, they're looking for contemporary information. So information that was produced and published around the time of the period. So if you were in an article in the newspaper in 2012 saying that you lived at this address and this blah, 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 that is going to count as residency. So when you come here to visit me, there's the address, by the way, and you can also visit everyone else in the staff. You don't have to just visit me. I won't be insulted. So we have a large local history and genealogy department. We actually have one of the largest in the country. We're well-versed in genealogy and residency verification, so we're here to help you on that. We have records on microfilm. You can pretend you're like a secret agent if you like. We have experience in providing referral services. So we don't like people to leave without knowing where to go next. So if you come in and we can't help you with something, we can at least say, hey, you should try here or try here. Now keep in mind that means we cannot get birth records in the state of Missouri. Those are actually very private. Death records in the state of Missouri, we can get those up to 1974, but there are other places where you can find those, and you can find those through our guides, or you can even ask us. So at home access, we are very proud to have the St. Louis County Library Digital Archives. So it is our online presence for digital information and historical information. It has a large amount of county directories on them, and these are going to be your bread and butter for residency. So the county directory is very much like the phone book before the phone book existed, and then it transitioned to the phone book. You can see a clip here. It's going to list the street. It's going to list somebody's name, what they did, the area they lived in. Sometimes it lists spouse, but remember, there's an implication. Child lives with their parents, spouse lives with spouse. So if you can find your father in a directory and you're filing a claim for your mother, bam, there you go. We also have yearbooks there. Yearbooks are accepted as well. And I always have to include John Goodman because it's our most popular yearbook still to this day. So there he is before he became Dan. Here's what it looks like when you go to the front page of it. You can click St. Louis County Directories. We made it nice and big because everybody needs to use it for RECA. We have our yearbooks. We do have some Missouri newspapers. We have some other things. You're really going to focus for RECA on those yearbooks and those St. Louis County directories. So take a look at those, go through that. And remember, if you find something on here that you can utilize, just come on into one of our branches show them that you got it from the digital archive, and they can certify it for you. We can also certify it here at this department. So at home with your library card, you still have access to the St. Louis Post-Dispatch collection. You have newspapers.com, which is going to have limited years, but still some years that are relevant. You have access to something called Heritage Quest, which is like Ancestry Lite. It's going to have some basic census records and some public records on it. You can also access Missouri Digital Heritage. You can find long-form death certificates until 1975 on Missouri's platform there. And you can check to see if it lists the cancer on there. You can also request one from the state, and we'll talk about that later on. Like I said, family search directories, census records, church records, legal records, all sorts. They're always adding new things on there. There are guides on the site on how to use these resources. You know, we're always sending out more education. So let's talk certification and how we're going to certify documents for you. So I want to mention again, if we cannot pull it, we can only certify what we can pull. So if we can't pull it, we can't certify it. So this can be done here at my department, or it can be done at any branch. I do want to advise you that wait times vary. We are always doing different types of service. So if you can make it as easy as possible for us, so let's say you find it on Ancestry, if you can make sure you document where you found it on Ancestry, that way when one of us can verify it, we can just pull it up easy. So any branch can help you out with that. So with the RECA lookup request form that I encourage people to use, your documents will arrive with a certification cover letter. As mentioned before, it'll be a copy of it because we're scanning it and emailing it, but that is acceptable to the Department of Justice. We have talked to the acting director about it. So as I talked before, documents that you acquire from one of our resources, just ask an SLCL staff member to certify the document. If you find it offsite, if you are offsite, submit a RECA lookup request or visit a branch with your document, but it has to be a document that we can get a hold of. So if it is your medical pathology report from the hospital, we can't get a hold of that. That's private. We can't do that for you. But if it's a yearbook and we have that in our collection, we can definitely help you out with that. There is a question, what happens if the yearbook you have is not in our collection? Is it on Ancestry? Is it on another site? If it is, we can certify it. If not, then we need to digitize it, put it in our collection, and that's a whole nother story, but you can always contact the library about this. So here's what our certification form looks like. So when we help you out, this is what it's going to look. And I want to advise you that the name of claimant is always going to be the person who was sick. So we're going to put that in there. We're going to talk about how many pages that we're giving you and who in the record it's pertaining to. So we don't put your name because it's your job to prove your relationship to so-and-so. We're going to put the document head, John Smith on it. So we're going to put pertaining to John Smith, printed from these sources at the St. Louis County Library. And remember, this is available at my department or at any branch. So some tips. I know I repeat myself. I used to be a former educator. We can only certify it if we can access it. We cannot certify medical records from your doctor. We cannot certify school records because we cannot access school records in the state of Missouri. There's a lot of privacy with that. Each document source will require a different cover letter. So if you come into a branch and you have a city directory page and you have a Hazelwood High School yearbook, you get 2 certification letters. We can't just write them all in one source. The print copy has to match the original source. So you can't alter it in any way. You don't want to put, highlight things on it. You can highlight the paper, but you cannot, it has to match the original source. So you can't supply a name. If they misspelled your name, don't put a piece of tape over there and put the correct name. Take the misspelling and we'll fix that. So, and I just have to emphasize the waiting time changes daily. Sometimes we get rushes. Sometimes we have other things going on, but we're always here to help you. So some certification FAQ questions. I am a patron who utilizes a homebound service and need documents certified. How do you help? How can you help? Submit that documentation lookup form. We will send it to you via email. Is a copy of the signed letter sufficient? Yes. Yes, yes, yes. It is, I promise. The organization that I received my documents from did not certify them. Can you please certify them? Can we access them? Sure. If not, you need to contact the organization again. Now everybody's starting to learn what RECA is. They should know by now. You just need to tell them what they're looking for. And you could just send them or copy and paste the verbiage from the form that says, I need this certified letter to state this. Can these documents be notarized instead of certified? So as you know, St. Louis County Library provides a notarization service. It specifically states, do not notarize these documents. We don't need to notarize these at all. That's a completely different thing that we're doing here. With the certification, all we're doing is stating that it comes from one of the resources at the library. I have to mention the St. Louis County Board of Elections. So they are a valuable resource. If whoever you're looking for, if you were a voter, you can request your voting records and it's going to have that address on it. And it's going to be one of your gateways to residency. You can actually go on there and submit a RECA request. I do have to advise you, they are about 6 to 8 weeks behind. It is a cumbersome process. So this is just another way to get that residency. So when you come to us, we'll try to help you to the best of our ability. If we finally go, look, we can't find these things, how about you try this or this? And by the way, you, for a fee, can get a copy of a census record. So the census is done every 10 years. If you are in the census, you can request yourself in the census. If you are in a household with someone, if it's your parents, you can request the census. You do have to pay some funds, but they will send you a copy of that census and it will have the address on it. This is just another way of proving residency. A lot of people didn't live and they didn't go to school in the area, they worked in the area. So if you worked at a place that was in the area, that on your W-2 would state that, or if on your W-2 it's going to state your address, you can request your W-2s from 1978 to the present. So a lot of people are going to the IRS. The IRS only goes back 10 years. The Social Security Administration can give you your W-2s from 1978 to present. So that is a good source. And by the way, that there is a cost associated with that. I would advocate that some of our officials waive that for RECA officials, but I am also not an official. So another way to access some residency documentation right there. And believe it or not, I mean, you have to get creative. So CaseNet has records going back to 1980, and they will have addresses on there. That's another tool that you can use. Public record database. So the public record database pulls from government sources that has some tools on there, that it has dates, it has address ranges. It'll give you a clue if you're not familiar with your address. Sometimes we forget our address. St. Louis County has property records online until 2014, personal property and tax property, real estate tax. So you can actually access those documents and it will list the address on there. It's pretty good to use. Since we can access it, technically we can certify it, why not? Like I said, be creative. So here's an example of a newspaper article. And my mother was so proud because I was on the honor roll in 6th grade. It shows what school I went to. So if Fort Zumwalt North Middle School was an impacted zip code, I would have at least 1 year residency because you can't get on the honor roll without being there the entire year. Think about billing statements from banks. Think about billing statements from utilities. Think about credit card billing statements. You are looking for a contemporary document that's going to have your address on it. And as mentioned before, if these things go through the mail, you have the envelope with the address. So if you have one of those, there you go. That was good 6th grade, by the way. So reminder, here is our dedicated RECA portal. You can access this recording after the fact. You can also just Google SLCL RECA and this will come up. It has that RECA residency documentation lookup request button on it. It has other sources. These will be great for you to use. I do have to go on my soapbox a little bit. So Vital Check is going to be a website that you need to use. It can get you birth, it can get you death, it can get you marriage. If you're doing things across the state, if you're doing things across the country, it has agreements with most states to provide documentation. This is the website you should be using, Vital Check, spelled not check the right way you would think. If you find another website that looks like this, that provides the same service, they will charge you more money than you need to pay. So this one usually charges between $10 and $30 for a record. There is one that looks very similar that will charge you the same price, but then add on $125, $150 service fee. So please, Vital Check. If you're ever in question, call the county of where you're requesting from. Ask them the best way to get an online documentation. I have lots of people that are like, I don't want to have to go downtown. I don't want to go to the Clayton. A lot of these records can be achieved online with just a little bit of digging. I also want to put this out here is that if you Google Department of Justice RECA awards to date, this shows you for our series of projects, how many pending applications there are, how many have been approved, and the funding that's been issued out. there seems to be this thought that, like, well, the government doesn't want you to get this. They want to make it hard so you won't get it. I do want you to notice that right now, every application, no one's been denied so far. And if you look at historically, hardly anyone was denied. There's like a 76% approval rate. So, the federal government is being accountable, but you do need to follow the rules. So please follow the form, do what the form asks you to do. Take your time and just go through the form. So here is our contact information. You can always call our number there. If you need history and genealogy help, if you need RECA requests help, you can visit a branch. You can visit our department over here at Clark Family. You can call and ask for help with that. There is our website right there. And remember, St. Louis County Library, we're here to help, and we're here to connect you to the resources that you need. So thank you so much for listening to me.
Wonderful. Thank you so much, Brent. We're going to go ahead and open up and go into the Q&A portion of this session. Any of my people on my panel, feel free to share your screen if there's something you have that pertains to a question that might come up. Amanda, Dawn, Karen, and I have been working through the questions. So right now our Q&A is quite open because Amanda's probably answered 97% of the 162 questions that have been answered our class so far. But I am going to go through and highlight a couple that I think are important just to reiterate as we close out this session. So one of the first questions was how do we get documents certified prior to submitting them? And Amanda's answer was a signed and dated cover letter or the stamp seal of the issuing institution act and certification. And so that is something Brent just also talked about how we can do that at the library as well. Are the payments awarded tax-free, or will we be required to port and pay taxes on them later? As Danielle pointed out, they are going to be tax-free. On the application, page 15 is for naming an alternate contact. If this is completed by the submitter, will both myself and the alternate get info or only the alternate? Amanda says that both would be contacted. Somebody said I'm hesitant to send original copies of documents and prefer not to wait for the online application, which is hopeful to be here in December. Are applicants guaranteed to get their original documents back? And Amanda says, yes, documents will be returned. Another person asked if I'm on Medicaid, can I still receive the funds without my Medicaid being affected? And the answer is yes. What if I pass away prior to payment receivement? Who gets the funds? And your surviving beneficiary would receive those funds. If you have multiple incidents of the same type of cancer, as well as other types of cancer that are on the list, do you need to get medical records for every single event or just one? And you only have to document one qualifying cancer. Okay, relative to providing proof of disease, can I provide certified medical records and request on the application for RECA program to contact the state cancer registry? Yes, you can. How long to receive funds once the application is submitted? Probably the biggest question that I think Brent and Just Moms are probably seeing. So processing can take 3 to 12 months, and you have 60 days to authorize payment once approved. And then that payment would be sent within 6 weeks after the authorization is received. So this is a question we've not been asked before in any of the other sessions we've done. So how will a claim be handled if, in the case of death from lung cancer, the person who died was also a smoker? And so Amanda said, we do not believe that other potential causes will be considered as long as residency prior to diagnosis can be demonstrated. If the application is denied, will they explain the reasoning? And Amanda says, if they have a question, even before making a decision, they will contact you for more information before denying. What if you lived in 2 different zip codes, which are included in the RECA compensation? Which one should we use? This person lived in one for 15 years and then has lived at another one for over 25 years. And so Amanda says, choose whichever one is easiest to document. And that goes for the cancers as well, whichever one is easiest for you to pull information from, move forward with that one. I have mailed the Department of Revenue over 2 months ago, and I have received nothing as of this date. And so Amanda just wants to remind people there is a great deal of backlog. Brent also talked about it. So they are working as fast as they can to get through documents. As somebody that observes what Brent and his department do, I see a long line almost every single day with his department, and his staff are doing as much as they possibly can. But then somebody else followed up saying, for anyone who plans to send a written request to the Missouri Department of Health and Senior Services for a long form death certificate, which we did have quite a few questions on the long form death certificate, this person said for them, it took 6 weeks for theirs to arrive in the mail after their request. So another reminder to be patient. This will come to you. Another question was, I am a surviving child. I was married and divorced. Do I need documentation for both? And Amanda says, yes, if your name has changed, you will. If I lived in several zip codes, should I list them all? Will I then have to show proof of all? You will need to list them all, but you only need to document the one. This is a question I'm going to skip and then come back to. If I sign to allow access to the Missouri Cancer Registry, do I still need to provide certified medical records? Amanda says yes, if at all possible. So the question I skipped is because I wanted to ask Brent this one live. So my parents both died but went to school and lived in the city where zip codes were indicated for RECA. Can we locate information via St. Louis County resources at the library, or do they need to go look at the city resources? And then what would you recommend for the resource to review?
I would say directories, and so we do have directories here. So if you want, you can start with us, and we could always, if we don't have it, figure out what city has, and then we can work out and figure that out for you.
Yeah. All right, now I'm going to jump to the Q&A that came in while I went through all of those. So if you have a question, you'll just go to the bottom of your screen, click on that Q&A icon and enter in your question. So Brent, question for the library. If the US Census for 1980 is not public and the library cannot access it, does that mean the library would not be able to certify it?
That is true. So it is not something that we can pool, so we cannot certify it, but you would be getting it from the Census Bureau. So I would communicate, if they do not send it certified, I would communicate that you would call back and say, I really need this certified.
And is there, this is someone that I've been kind of communicating with back and forth in the Q&A while the session has been going on. Do you think there's other creative ways that we could maybe find the information they're looking for? I believe this was for their mother.
Oh yeah, there's always creative ways. I mean, that's what we
Yes.
have to do. So you have to think about, all the time I'm telling people, like, it's live, work, or go to school. So did they go to school in the zip code? And that could be college. I mean, it could be, we have junior high yearbooks we're finding. There are transcripts, some church records state address, or there are some church records that list membership. So, you can go that route. It's all about exhausting all resources, and we're here to help with that.
Thank you, Brent. All right, so somebody hopefully can infer what this is. How do I get the form for a person who was an on-site participant? Do you know how long it takes to get those work records?
That's another RECA project. So is that not part of the same form? I believe that's part of the same form. And unfortunately, I'm only well versed in records for the Manhattan Project. So not sure on the site.
It's like, Don, did you have something to add?
I was just thinking about it. I mean, if this person is talking about an individual who worked at one of the covered facilities covered on the Energy Employees Occupational Illness Exposure Form, that's a different program, but an important one that covers all the workers at like downtown Malincrot and out at Weldon and some of the other sites. If you wouldn't mind emailing us at westlakemoms@gmail.com, if that's the case, we can get you in contact with some people that work on that program that can help you.
Thank you, Don. Brent, will you certify a document if the person prints it from Ancestry?
Yes, as long as I can make sure that it is from Ancestry and has not been altered. Happy to.
All right, Amanda, this might be more for you. Isn't it simpler to file online? This way, certified copies are not needed. Is that correct? And it's anticipated to be open in December.
So what I can say is yes, it's due to be open in December. That's the latest we've received. Yes, the Department of Justice has said that certification will not be required. Will it be easier? That remains to be determined. As of right now, the paper process is what's in place. It is fairly straightforward, even if it does take a great deal of time in some cases, in other cases not. So I encourage everyone to begin with the paper process. You'll need the same documents to file online, even if you don't have to certify them.
Thank you. Right. Next question is, I have 27 pages of medical records. Do they want all of them? Danielle says, ooh, I see two different. Yeah, go.
So you need to submit what has been certified. So if your provider in the cover letter that accompanied those medical records indicates 27 pages, then you need to submit all 27 pages. Or if, for example, if you are providing the pathology report or another kind of report and it is 27 pages long, even if the diagnosis is indicated on page 1, you need to submit the entire record.
Thank you.
I will add that the form also tells you, for medical purposes, what you can submit for proof.
All right, Brent, does the library have directories for McDonnell Douglas?
Employee directories, no, we do not, but we might know people who do. So that's something we could look into. I would say if you're talking because you worked at a facility, yeah, McDonnell Douglas, if you can get a W-2, I know their W-2 sometimes use like a standard corporate address, but that might be something Missouri Historical Society has in their collection because they do have some of those items, and that would be something I would contact them about. They're very nice over there.
We've been getting that a lot of those.
Likewise.
All right, somebody asked, did I say that I will email out the presentation? So once this is uploaded to YouTube and posted, I am going to email anybody that registered for this event, this recording. So you will get the recording link emailed to you probably later this week. Oh, right. So this one's a bit longer. So after years of reviewing my lab work, it was determined that a biopsy of my thyroid should be performed. After the biopsy was performed, it was recommended by both my primary physician and my endocrinologist that I was at risk of 75% of developing cancer. Recommendation was to surgically remove the thyroid. I underwent the surgery and my thyroid was removed. Am I still eligible?
That one be for me.
I don't
Okay.
know. What do you feel?
That's kind of tricky. I mean, right now you have to be diagnosed with cancer, and so I'm glad they removed it to prevent to decrease that risk. But it doesn't seem like you will be eligible because you wasn't diagnosed with cancer. There was a risk factor there, and sometimes people can have a benign thyroid nodule, but there could be a concern it could develop cancer, and they would remove it. So based off that information, I don't believe you will qualify.
Thank you, Dr. Cunningham. So one question, and this is probably a really good question for Dawn and Karen. What can we do to get 63136 and 63137 included?
I think the answer can also come from Dr. Cunningham, which is we're working really hard to gather statistics, looking in other zip codes. We also have a researcher. Her name is Debbie Disser. Many of you know her. She has been thoroughly going through some new archives down at UMSL, looking through and finding some very old but shocking documents of other areas where there could be radioactive waste, or areas that are considered haul routes where waste traveled through that community to get to another location. And documented spills along the way. All of those documents are going to go straight to Senator Hawley's office. As Dr. Amanda will tell you, Senator Hawley's office is amazing when it comes to any new information and what to do with it. And while this program is up and running, though, for the next 2 years, we don't anticipate that there'll be any changes made to it because there won't be a way to get those changes through. But when it comes up for reauthorization, that will be the time. And so stay tuned. But I would recommend, if you are concerned about an area you live in a zip code, please email us at westlakemoms@gmail.com. But please also reach out to Dr. Cunningham, who is also on this, to collaborate with her and speak with her office. Dr. Cunningham, how should people reach you?
I will leave my email in the chat
Thank you.
Okay.
in the departments. I'll do the department's email.
Dr. Amanda, are we still suggesting that people leave a message on the tip line for the senator's office when we come across these included zip codes?
It's always helpful to us to have the numbers and the statistics, yes.
Thank you. Brent, this might be a question for you. It was one I answered and then just popped to my mind that I was going to ask you live. Somebody had a copy of a directory from Polk County, and it's older and kind of smudged, and so it's hard to see where that person's residential information is. Is it okay for them to highlight on the copy that would hopefully have been certified the information that needs to be looked at?
Yeah, you can highlight that. So Polk County, or is it a Polk directory?
I think
Uh,
it's Polk directory.
Okay, so yeah,
Yeah.
I would see if we have a better copy of it before I would go the highlighting route, but you could always highlight it. Some people want to make it really easy for the RECA paralegals. I believe that we should just submit them original if we can, but check to see if we have a better copy. You can look on the SLCL digital archives or come in.
This next one's for you as well. How does a yearbook get used or certified?
So the way it gets used is that we are proving that you went to school in an impacted zip code. So we would look up, the school is in the zip code, yay. We are going to find you in the yearbook with your name, and then we're going to scan it, print it out, certify it. Now, where it gets into, so when we certify it, we're saying we have it in our collection. So if I do not have it on my shelf or on my digital archive, I can't say it's from my collection. So yeah, I would work this out with you as a person and be like, hey, would you mind if we scan this and add this to our digital archive? We'll give it right back to you in a couple of weeks. And so we give you a form for transfer of ownership so that we temporarily own it. We scan it, we call you back up, you get your form. We have the ability to help more people from your school in the future. So if you're watching this and you're a school administrator from one of the impacted zip codes, send me all your yearbooks. Call us and be like, hey, I have all these yearbooks for you. If you have already done this process or you have yearbooks that we could utilize, please let us know and we'll happily scan them. You could be helping not only yourself, but others out there. And we really appreciate that. So we just certified off of that.
Awesome. And then another yearbook question. Do you have Catholic school yearbooks, for example, St. Ferdinand that was in fluorescent?
So we do have some Catholic school yearbooks, but I can't off the top of my head say all of them because they're like 2,000 yearbooks. But I will
Come
tell
on,
you
Brent.
that if we don't have it, the Archdiocese is going to have it. So they're always, and they have a lookup form just like us. They, last I heard, they're about 6 weeks behind. But hey, 6 weeks is not that long. Keep doing that other research out there and digging. We're all here to help.
Thank you. So there's a couple that came through recently that Amanda answered that I want to pull out. It was, if additional zip codes open up, will the RECA filing deadline be extended for all zip codes or just be added as new zip codes? And Amanda says, we're not sure, but likely it would be extended for all included zip codes. But would that likely be happening at that 2-year mark when the renewal? So the hope is that this act would be renewed, and that's when those new zip codes would be added, hopefully, because the next question was, do you think they'll be adding prostate cancer as an eligible cancer? If they're able to add new cancer diagnoses, that would hopefully also be when they would add those in, which would then follow the new 2-year filing deadline, correct? Yay. All right. Oop, yep, and somebody asked if I have a yearbook, can I bring it in and have you scan it? And the answer was yes.
Yes. So now that being said, if you want to donate it to us, you can donate it as well. If you just want to loan it to us, we'll take that. But I am only at the Clark family branch. So if you want to discuss this and do a turnaround, so if you bring it, just to give people a way the workflow works, if you come in with it, I will scan that page with you on it and the cover page immediately, certify it, give it to you, and then say, please let me hold on to this yearbook until we're done scanning it, and then we'll do some forms. So you'll walk away a happy camper, and then we'll get your yearbook back to you if you want it. And we will redact anything that's racy or anything crazy that someone wrote in there.
I'm imagining you must have seen some things. All right, so this is a good question. Amanda's currently answering it. My mother is 91. She's easily confused. Is it required that she still file since she is still living, or can she handle the filing? The person that was asking handle the filing. And Amanda says, yes, the person that asked can handle the filing. All right, we get thank yous. We've had multiple thank yous throughout this presentation for all the panelists involved, especially to Dawn and Karen for their hard work throughout the many years to get this where we are currently. All right, this question just came in and we had two people answer at the same time. So what if you've been diagnosed with cancer and had it removed? Do you still qualify? At the same time, both Karen and Amanda said yes. We still have time for questions. We have about 26 minutes left. Amanda, are there any questions that you see often that came through that you would want to just shout out while we have people live?
I know we've touched on this a little bit already, but I just want to reiterate the kind of the timeline that we're dealing with. So once an application is received and and a staff member at the Department of Justice actively begins to review it, and I do want to emphasize that there is often a lapse of time between when an application is received at the Department of Justice and when a staff member begins to actively review it. Just because you have not received a claim number does not mean that the post office lost your application. I have only heard of the 1,400 applications that have been sent in. I have only heard of one case where it seems like the application was misplaced. That's a tremendous record for the US Postal Service as well as the private mail carriers. So please allow for several months for your claim number to be sent to you. The Department of Justice is working as fast as possible, even during the shutdown, to process these applications, but it does take time. Once you receive your claim number, it could be an additional 3 to 12 months for processing to happen. Once a decision is made on your application, you will be notified. If your claim is successful, you'll be asked to authorize payment. You will have 60 days to return those forms to the Department of Justice Finance Department. And then payment usually occurs 6 weeks after this. Then your documents are returned to you, and it can be an additional 12 months for documents to be returned. So please keep in mind that this is a very lengthy process. There are lots of individuals working on this, and the reason they take their time is because your documents and your application is very important to them. And they do not want to be hasty in their decision, and they do not want to lose any of your documents. So it is going to take some time, and I just want to urge everyone not to be anxious if you don't receive information every other week.
Thank you. That gave some time for some more questions to roll in. So, Brent, if I bring a certified copy of my marriage license and birth certificate, can you scan it and certify them at the library? My answer to that would be that if they're already certified, there's nothing we could do. So if they're certified already, you have what you need for your marriage and birth certificate, but we would not be able to certify
Yeah,
those
so
documents.
those would not be, I do have limited marriage records in our collection that we can pull, but if I cannot access it easily, I cannot certify it. So it has to be something I can pull up and go, hey, it's right here in front of me, and print off myself. So, but if you do have a certified copy of it, and I have to stress, like, if you've ever done the passport thing before, they send your documents back. This is something that, this is not new for the government. They know how to send your documents back. And, I don't know anyone who's lost their document, as Amanda said, like one reported time. Trust the USPS.
If
Right.
they're from St. Louis County, you can order certified copies from St. Louis County if it's a marriage and birth certificate.
This was answered already, but I like to say it for all people that are still here. Can you receive benefits for both parents if both have qualifying cancers? The answer is yes. I liked this question too. Not liked it, but I think it's important to say it out loud. My husband's death certificate lists the cause of death, but does not have the doctor's signature. Is this a long form? If not, please give info for how to get that long form. And Amanda put that the long form is available from the Missouri Vital Records and should have the signature. I think I remember from our first RECA session, we said that the long form is probably the better form to get because it will have all qualifying diseases on there. And because sometimes someone might die of a heart attack but have also had cancer. So the long form would list everything. Do we need to make an appointment to visit the Clark family to get things certified?
No, you do not. So you can just be in mind that we don't accept appointments for certification. There could be a line and we'll just ask you, please, take time. We're all getting through this as fast as possible. We have several people on the floor at a time assisting folks. And as I mentioned before, if it's something that you don't need us to pull, that you have pulled and can easily prove that you have pulled it, any branch can certify it for you. So, yeah, I would urge people, if you are not capable of looking for the documents yourself, do that RECA request lookup form or come in and we will actually, I like to give people assignments. I will give you a directory and say, okay, we're going to utilize the alphabet to find your last name and we're going to pull that information and then we'll certify it together.
Thank you. So we have the next question. Deceased spouse was married before. They have the divorce decree from that marriage, but not the marriage license itself. They were married in Jamaica. Will just the divorce decree work?
I can try to answer this one. So this is a pretty specific case. What I always tell individuals is they should try to provide the documentation that is specifically requested by the Department of Justice. If in your case, though, it is impossible to obtain one of those documents, provide what you do have. And then I encourage applicants to submit just a note with their application to the Department of Justice explaining why there is a missing document. This really helps the Department of Justice to know that this is not an oversight on your part, but that there is an actual reason why this document is missing. So provide what you can.
I would say
Thank you.
I've heard this a lot too, and what Amanda says is correct. Like nothing's perfect. There are going to be cases where documents just don't exist. I just the other day someone didn't have a birth certificate ever. So in those cases, remember the Department of Justice, they're human beings. These are human beings reviewing all of these applications. I'm not going to say that everything will work out, but you got to provide a narrative and go through that. And you know, the main thing is with the marriage that they're trying to prove to make sure that someone didn't have several other marriages out there and that someone else should be eligible for whatever is going on and to document name changes. So they're human beings. And one thing I think we say that we don't stress enough is when we say you get 3 chances, 3 strikes, it's not, it's rejections. It's not when they come back and say, could you please supply more documentation? They're going to ask you for more documentation if they need it. That doesn't count as a strike. It's an actual rejection that counts as one of these strikes. So they're human beings. But you do have to try your best and you have to document that you've tried. What step did you take? Did you contact, the Jamaican embassy? Did you go through that route? The best you can show that I've tried and this is not out there is going to give you more success.
And to
you.
Brent and Dr. Amanda's point, one thing that Karen and I are hearing a lot of is we are hearing people that the Department of Justice is getting in touch with them. They are not simply just denying, they are saying, hey, if there's something they have a question about, right? They are reaching out before they make a decision and contacting those individuals and giving them a chance to either send in a missing piece of information or explain why a piece of information is missing.
Thank you. The next question was if there was cause for a decision to be a no for an application, even what would be that cause if everything was good? And so Amanda had answered it very early on in the presentation for another Q&A, and Dawn, you just touched on it, that they would reach out before just being like, nope, they'd want to contact you first.
I mean, I would also add that if you look at the stats for the overall project, all of the RECA projects that have been going on, there is a 76 average % approval rate of people who apply. It's not 1 in a million. It's most people who apply who are submitting the correct documentation are getting accepted and getting approved. So, definitely get everything you can get out there. I think I stress enough that if you feel like your zip code should be added in the future, you can begin collecting the necessary documents so that you're good to go when that time comes. If get that birth certificate, get the divorce records. Obviously it's going to take some time, but you have time right now until they add that. But do your due diligence. But I see a lot of people. So with Dawn and everybody in the gang, we're always on social media trying to help people out with answers. And some people are just getting so frustrated and giving up. Don't give up. I'm not an attorney and I'm not here to give legal advice, but you don't need an attorney for this. Don't let someone take money that is yours. You can do this. So just follow that form. Like 99% of questions that are on social media, if you just read the form, if you read the form, it's going to tell you, but take your time. Like it's definitely a government form, but as far as government forms go, this is not that bad. Like I've seen some doozies, and this is like definitely like I'm gonna give this one an 8 out of 10 on niceness.
Thank you, Brent. And just to add to Brent's point, everybody on this panel is a tool in your toolbox to use for assistance, whether it be helping find documents or she couldn't make it with us tonight, but the director of the Pink Angels Foundation joined us in an in-person, and they are very willing to look over applications and look things over before you send it in. So we are all here to assist. So don't give up, Brent. We're going to be helpful. So if will the Department of Justice pay out separately if you are a claimant, and then if you are also related to someone that has died, or would it be one lump sum?
That's one I'm not actually able to answer at the moment. I don't know how they're going to actually deposit the funds. That is a separate form that actually comes to the individual once the claim is approved. There are particular financial documents that have to be filled out and submitted to the Department of Justice. So those things will be decided then.
Thank you.
Can I add though, I kind of skipped over this and usually I mention this in the presentation. When we're talking about these applications, especially if you're applying as a surviving child and you have siblings, please enter as much information about all these siblings as possible. Do not try to ice out any family members and not tell them about this. The DOJ will find all beneficiaries, all the siblings. So one thing that's going to make your application process faster if you're applying as a surviving child and you have siblings is if you get all the documentation for all of the siblings at one time and have them all sign the application. That's going to make that application process go faster. Otherwise, the DOJ has to go find everyone and contact them. And so that's going to make the process take longer. So even if you no longer have contact with that sibling, you don't know where they are, at least list their name. And as Brent mentioned earlier, presenting a cover letter with a narrative explaining why you don't have a signature or documentation from that sibling is going to help that process move along. But trying to get one over on family members or is a situation is a one family example. And I saw this question in the chat, I think somewhat related. So I got contacted by a family member. The woman, she was diagnosed with, died of one of the eligible cancers, living in the impacted zip codes. She had been married to a man that the whole family hates, very abusive, but unfortunately she never got divorced from him, right? And he's still living. So technically he would be the beneficiary, not anyone else in the family, not the children. It would be that surviving spouse because she never went through with getting divorced. Unfortunately, it would be that surviving spouse that is the beneficiary.
Yeah, I'll just add on to that it's not a RECA session unless Danielle uses the term ice out somebody. But I do want to add on to that there are many cases where we have people that we're assisting that have someone in their life, a sibling that they don't know where they're at and they don't want to talk to them at all. So in case you don't know this, there is no privacy anymore in the world. So if there are public records where people are at, you can supply that in your narrative, like, I think so and so is here, this is where they're at. But if you don't have that information, they're still going to process your claim. It's, they're going to have to find, and I don't want to get, it's the government. They'll find you. I also would add that we didn't talk about, if you are a stepchild, you are eligible if there is a stepchild parent relationship. So that is something there. Grandchildren are eligible in other projects, so be careful when you're researching, because there are different projects that have different rules. So, and I'm sure you could always submit feedback on what projects need to be modified to the Holly office. They're always looking for feedback and more stories. So, but definitely that when you do this research, different claims matter for different projects. So make sure you're looking for the Manhattan Waste Project.
Great. Thank you all. We have about 10 minutes left. So I think the next two are for Brent. For confirming presence, this person has SLCL documents that show home ownership for 2 years, and the name is their husband's. So will they need marriage license for that? Do they also need marriage license for the former marriage that showed the name change from my birth name?
So going back to the form, it is what you're proving is residency. If you're proving, so if I think you're saying a directory, so probably not a deed for home ownership. So if the spouse's name is on there, you're going to have to document how you're related to said spouse. But also, if you're self-filing, you're going to document your name changes. If it is a surviving spouse, you're going to document the relationship. So just follow the form if it's asking you for that. If this is just for residency purposes, as what we help out with, you do need to provide how you're related to the residency person and name. So if your name's not listed on that directory, you're going to have to explain how you are related to that person.
Thank you. And then do our friends over at St. Charles City County Library have access to all the same items we talked about? They put like marriage and divorce in St. Louis County. Could they then certify it if they pull it?
So I will tell you that St. Louis County Library is one of the best in the country. So, and we're very proud to be that. So I can't really speak for what St. Charles County has, City County, but they have started their own RECA assistance, and they do have directories, and they do have deeds, and they do have those items. And I am, as a person who doesn't work for that system, I believe they are certifying, because they've asked us for our process. We're very proud to be a library that's like, we send all of our certification out to the archives and libraries so they can follow our footsteps. So I think they're helping us. I think they have access to the same things. I will tell you, go check. If for some reason they can't help you locate what you're looking for, over here, we love to help. So you do not have to be a St. Louis County Library patron for us to provide assistance of any kind. If you notice anything on our website when it does the RECA request lookup, you don't have to have a library card. We're not going to be like, whoa, this person doesn't have a library card. So we're all here to help. We're all in this together. So hopefully they can help you. If not, see if we can help you.
And that's where that lookup form comes in handy, because Brent will email you direct. We are not Brent specifically, but someone from History and Genealogy, specifically Brent. Karen, I saw you answer a question and I wanted to grab it. Do I need to make an appointment to meet with you to go over the documents I have and or need? And I'm glad you got it, because I was going to ask, what's the Pink Angels Foundation doing? So you can make an appointment with the Pink Angels Foundation. Their phone number is 314-441-4040. And then I've dropped their email in the chat a couple of times as well. Oh, got a lot of thank yous.
One
Yes,
second.
Brent.
So just point out for the Pink Angels, they are a bunch of volunteers. So like, we are getting people like, well, they won't answer the phone. They're all volunteers helping people. So give them some grace. If that's my motto for 2025, is give everyone some grace. So they email them. They do accept appointments. It's on their door. So email them, try to get an appointment. If you walk in, they may not even help you immediately. They're going to communicate, but like, we have a lot of people like, well, they never answer the phone here. They never answer the phone at the RECA thing. Dude, we're all just us. There's not that many us. We're trying. So Grace,
And I
2020.
will say this, yeah, Dr. Jones, I know she said yesterday alone they had over 175 phone calls in the queue at one point. And so just so everyone knows what we're doing, I mean, obviously these sessions right here, look at all the questions. I mean, Dr. Amanda really just like threw all these answers out. Thank you, Dr. Amanda, so much. But, you know, we get a lot of, can somebody just look over the form and make sure it's okay? First of all, the only person who can decide if it's really okay is the Department of Justice. Let's just get that straight, because we're all just all volunteering and doing, but they make the decision. But we are working, Karen and myself, with others. I know Danielle's on here. I know Dr. Cunningham. We're working hard to see if there are other locations that maybe we can do a couple evenings a week at, or whatnot, and get some more volunteers to help people just look over. But as Brent mentioned earlier, what we are finding and what he said is absolutely correct. Read it 3 times. Even when we're sitting there helping someone with an application, and just, it usually comes down to they just didn't read it that 3rd time, or even that 2nd time. And even just reading through it with them, the question, it's the answer sitting right there in front of them. They're like, oh, okay, I need to do this.
Yeah, sometimes it takes hearing that other person read it out loud that make like it sinks in.
Right.
I would also add, so if you have friends, family that you know lived in one of these impacted zip codes, tell them about this. Spread the word. We're not getting enough people from North St. Louis, quite frankly, and I'm worried about it. So tell your people.
I wanted to share this comment from somebody that's watching, because I think a lot of people that are viewing can relate if they're filing for a deceased parent. But this person was thanking us for their answer and then said, our mom died some time ago, so it was difficult to find all the old documents. What is funny is she didn't keep those, but she did keep receipts for stuff like cameras. So we all know that pain and that fun thing of mom, why would you keep that receipt for that? You don't even have that camera anymore. So thank you, Bill, for sharing that. But that is also where we come into play to see what we can assist with.
I mean, I will say that everybody in their family has that person who keeps on to too much, maybe borderline hoarder. This is their time to shine. They're the ones who have the tax receipts, the marriage certificates, all that. So apologize to them and get that documentation.
Yes. All right, we have just a couple minutes left. One question just came in. My mother has one of the diseases and I was born with a hole in my heart. Should they apply for themselves? Like I'm seeing Dr. Cunningham saying, no.
Yes, unfortunately, this is one of those cases where the Department of Justice is going to be very strict about looking at only those eligible cases based on the list that has been published. So if you see your diagnosis on that list, then I certainly encourage you to apply. But if it is not there, then you do not qualify at this time.
Thank you, Amanda, and thank you for sharing that with us.
I know, I think Dr. Cunningham can acknowledge this too. I mean, yours to this person, your specific health impact is something that we are hearing of a lot. And we want to recognize that it's an abnormal amount, and that, Dr. Cunningham has some ideas, we all do, of ways that we can look at other illnesses. But as Dr. Amanda mentioned, it is going to be a process. RECA has been around for 35 years. And while there have been some cancers that have been added, it's been a difficult process. And but as we walk through it and as we do these kinds of events, we come up with even more ideas every time we're together on how that could work and how we could coordinate. But the most important thing is the coordination we have right here as a team. This level of coordination is going to have to occur in the other RECA communities and states in order for these illnesses to be added, because it's going to take them compiling their own statistics and then us sharing across multiple states.
But we still do need your stories. We need to hear those stories.
Yes, thank you. Thank you. So we have 3 minutes left. Brent, I
One
was
thing I
going to
want-
ask for closing thoughts, but go ahead, Brent.
One thing I wanted to add is that I'm seeing a lot of people, and we've talked about this earlier, that like FedEx delivery drivers that delivered in the zip codes for 10, 20 years. And when you get that information from FedEx, so like FedEx may or may not, the companies, well, let's not target FedEx, but any company may not release documentation that states Chuck was on this route in this zip code for whatever. You're going to have to go the affidavit route. So you're going to have to get some of your colleagues, your coworkers. You have a long battle ahead of you. So try to do your best what you can. You're building a case. So get the affidavits, and that's the only time notarization is actually acceptable in this case is through an affidavit. So get people to say like, yes, Chuck delivered to narrow gauge every day or whatever. I don't know, whatever location you can find in there, but like you can do this. It's daunting, but you got this.
Our recommendation with that is start with your union. If you were a union, like if you were a Teamster or whatnot, we're finding that they are keeping the best records of specific routes. And that, as Brent said, somebody from your union that keeps records of those routes or really knows them would probably be the best official to do that sort of thing for you.
All right, we got 1 minute left, so I'll just do some closing thoughts. So thank you to Amanda, Brent, Danielle, Dawn, Karen, and Dr. Cunningham for joining us tonight. I know this information has been extremely helpful to the community. And as mentioned, this recording will be sent out to everybody that registered, and then somebody asked if they could share it, and our ask is that you do share it. So share it with your friends, share it with your family members, share it on your Facebook, share it in your next door neighborhood group. That way we can help get the word out of what we're able to do when we all come together to assist with a cause. But thank you all, and we will go ahead and close out for the evening.